I'm Dr. Regner from New Hartford Animal Hospital, and in recognition of National Veterinary Dental Health Month, which is in February, I'm here to dispel a few myths and common concerns about dental procedures. The biggest concern that I hear about most often is anesthesia. Pets unfortunately aren't agreeable to scaling and polishing their teeth without anesthesia, so it's something that we have to do. Anesthesia I know can seem really scary, but it doesn't have to be. With the right precautions, physical examination, blood work, and considering the patient's age and health, we can make the right decisions for what kind of anesthesia would be best for your pet so that it can have a safe dental procedure. Not all pets are the same, so same thing with your anesthesia. Not every doctor is going to use the same medications for the same patient, so keep that in mind. And many of our medications for anesthesia are even reversible, so that if there is a problem, we can wake the dog or cat up right away. The other thing is we have great technicians here who are closely monitoring your pet during all of the procedure from start to finish. Pulse oximetry, EKG, oxygen, respirations, heart rate, everything, blood pressure. So at any given moment, we know where the patient is and how they're doing. The other thing that a lot of people ask is, can I just brush my teeth? Why do I need to have an actual dental procedure? While brushing is effective, it's really only a preventative. Once the tartar builds up on the teeth, it forms a cement binding to the tooth, and it can only be removed with scaling and polishing, similar to when you go to the dentist, although we open our mouths and wait in our patient. So the only difference is the anesthesia. Tools are the same, the fluoride is the same, even bubblegum flavored. The other thing is, once the dental procedure is done, then you can start brushing. That's a great time to worry about the outside of the teeth, not even so much the inside. Their tongue is rough, so it helps to keep them clean. And brush the outsides of the teeth. If you can do it every day or even every other day, you're in really good shape, and your pet may not need a dental cleaning as often. Same thing with dental chews, greenies. Purina makes great dental rawhides. Use those. Those will help, again, to clean the tartar off of the teeth. Don't feed wet food. Unless your pet has a medical reason to need the wet food, it sits on the teeth and leaves residue where the kibble kind of helps scrub them away. So keep that in mind. A lot of people ask me, does it hurt? No, it doesn't hurt because it's not invasive. We're not going into a cavity. We're not making any cutting. We're not doing anything like that. It's literally just like you going to the dentist. So there's no pain involved. Also, they're under anesthesia, so even if there was pain, they would not be aware of it. Sometimes a tooth does need to be extracted, whether it's fractured or something like that. And if that's the case, we can use nerve blocks, just like lidocaine if you have a cavity, so that the nerves are not responsive, so your pet isn't feeling it during and or after once they wake up. The last thing I'd like to remind you is that keep in mind, although your veterinarian tries to look at the teeth during an exam, most dogs and cats aren't amenable to really getting a good look. So the dental exam is also a time for your veterinarian to look into each crevice. Are there any periodontal pockets that are hiding during the normal exam? Any broken teeth? Anything like that. So it really, from start to finish, is a great way to help your pet have good dental health and overall health. Also, to celebrate the Dental Health Month, we are doing a dental promo at New Hartford Animal Hospital where all our dental procedures are $50 off, no matter what your pet might need, whether it's just a cleaning or maybe even extractions. And a lot of our dental products are 40% off. So come on down and see us, and if you have any questions, you can always call.